From the heart of the nautical mile, you're listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to letting you live healthier, better, and longer. We have a great show tonight. We have Long Island's premier dentist on the South Shore, Dr. Dave Beyers. Dave, I want to welcome you to the show, taking some time out to be with us.
Thank you very much, Dave.
You know, I always like to do some research and talk to people about our guests before they come in, and I assure our listeners we're going to have a great show tonight. So before we get started, just tell our listeners a little bit where you practice now, how long you've been there, that sort of thing.
Practicing in West Islip. Been there for 22 years, and right in the middle of the South Shore. Yeah. And we get people coming from all over the place. But South Shore is my favorite. Mm-hmm. Been here for pretty much my whole life, and very comfortable.
You grew up on the South Shore, didn't you? Grew up in the area?
Yeah, grew up in Babylon.
Now, a lot of our listeners don't know this, but you have dentist as part of your DNA on both helix. So tell our listeners, you have a long lineage of dentists in your family, don't you?
Yeah, I do. As a matter of fact, when I was in dental school, my best friend, who's now a big cancer researcher, not doing any dentistry at all, said that I had an unfair advantage in that I had the dental gene. So it seemed that no matter what project we were given, I already had some facility with it without ever having done it before. So I guess there maybe there was a little bit of transfer.
Now, you were telling me before the show that your dad was a dentist, mm-hmm. and both your grandfathers, your maternal and your paternal grandfathers, were dentists, and your wife's grandfather was a dentist?
My wife's father was a dentist.
My wife's father was a dentist. So let me ask you a question. So you grew up in a house where dentistry was talked about all the time. The house must have smelled like tooth, I would imagine. So from a young age, you were reared observing dentists. And what are some of the things you observed in your father or maybe your grandfather that were qualities that you said, you know, I want to be a dentist. I want to be like that?
It wasn't so much dentists as it was medical people in general. My uncle lived around the corner. He was a physician, internist, first hematologist on the island, just recently retired. Still both alive, by the way. Dad's 94 and Uncle Mitty is 22. He's 92. And
his wife is 22.
His wife is 22. No. And so we and my grandfather was still practicing up until he was in his 70s. And it was always an honor to be part of the medical field. And that's how I grew up, never thinking that I was going to be a dentist, really, or a doctor or anything, as much as just someone that wanted to make a difference with people, because this is what these guys did. And when we would have people over for dinner or we'd go out, the discussion was always not about specific people or patients, but it was about philosophy and ideas and ideals that they were trying to aspire toward. And I think in many ways they hit the mark.
A lot of people either haven't grown up in that environment or aren't quite sure what you're talking about. So tell our listeners really what you mean by them, and what did you observe listening to those conversations that you wanted to emulate?
First of all, there was passion, there was excitement, there was desire. In order to, many times when you would go to people's friends' houses, the parents would come home exhausted. They didn't enjoy themselves, whatever they were doing. They were doing it strictly as a means to make money to survive. In the medical field, especially back then, before the insurance companies came in and sort of trotted on everybody, but back in the golden days, the 50s, the 60s, it was like being part of a club that was a lot of fun to go to. And they exchanged stories of successes and tried to benefit each other by adding to whatever knowledge pool there was available. And there was a lot of, even though I didn't understand a lot of what was going on, I knew that these people were enjoying what they did and that they felt worthwhile, they felt worthy. And by and large, they all made a difference, and they wanted to make a difference, and they instilled that in me, and everyone in our family was don't aspire to be average, aspire to be excellent at what you do, and try and make a difference.
Mm-hmm. You sort of have an interesting backstory I just want to tell our listeners about, too. You know, the typical, many of the guests I've had on the show have followed a very traditional path. They, liked working with their hands in high school. They did well. They went to, right out of high school, they went to their 4 years of college. They knew in college they wanted to be a dentist. They went to 4 years of dental school, and they got right out. But you've had some interesting life experiences before you decided to become a dentist. So maybe just briefly tell listeners about that, because there's some great stories in there.
Okay, well, I would say the first adventures came out of just a total luck experience of being born in 1952. So by the time I was 12 years old, there was what we call a natural set of clams in the Great South Bay, which all it means is that the bay was flooded with clams for reasons that we don't really understand. So anyone that had any kind of ability, desire, could go out and actually make more money clamming than they could selling papers or the traditional things that kids do. So when I was 12 years old, I went out on the bay, and that pretty much paved the way for a different type of a life, because by the time I was 16 years old, I was making as much money as most of my parents' friends were making, and I was doing it in an environment where I was building myself up. As a man, I wanted to be strong, so I enjoyed that, and we were kids. We could do anything. I never had to ask anybody for money. The bad part is I never had to ask anybody for money, so I could make as much money as I needed to survive for the whole year in 3 or 4 months in the summertime. By the time I was 17 years old, and I started my excursions based on the fact that I was able to, because I never needed any money. How
old were you when you decided to go to dental school and become a dentist?
28.
So that's a little later than most people.
Yeah.
That's a little late. Is it something you always had in the back of your head? How did you come to the realization that that's what you wanted to be your life's work?
Never had it in my head. Always thought that it wasn't a lifestyle that really appealed to me, and it was basically when I got serious after I had met my wife, and I got serious and went back to school. I was clamming part-time. I called it my Clark Kent Superman period, because I was commuting to Stony Brook and completing an undergraduate at 26 years old that I should have completed when I was younger, but that's another story. And I would juggle the two worlds, where I would go to school. First I would clam in the morning, then I would go to school at night, and then I would come back. And I found that when I applied myself, it was not too hard to get a 4.0 average. So I was doing very well, and I found out that I was the best in organic chemistry. I was number 2 in my class out of 600 something, and they wanted me to go into chemistry. I became a chemistry minor just because I had so many credits, but I didn't want to be in a lab either. So then I started hunting around, and I said, well, my dad seemed to be have a little more time for the family than my uncle. So I figured, okay, I'll be a dentist.
And how'd that work out? Did you make the right decision?
Yeah, well, I love the dentistry. I've always loved the dentistry. I love everything. It's not just the working with your hands, it's the working with the people. So even if I do the same procedure 1,000 times, it's different each time because it's a different person sitting in the chair.
So let's talk a little bit about your practice, and maybe who's the typical patient that you see in your practice?
Typical patient I see is a family, usually double income families, double jobs, working hard, happy to be on Long Island, happy to have a job right now in this current environment. And they've been referred by someone that they know and trust, and they've usually had some kind of a negative experience at a dentist, and they've been told that I can rectify that for them and help them out dentally, as well as any phobias they have. I'm very good with people who have anxiety about going to the dentist, so I assuage their fears, and I turn them into people who are excellent patients, and sometimes that even transfers over to other aspects of their lives.
I assume some of the people that come to you have been away from dentistry for a long time for whatever reason. What do you think are some of the biggest reasons people maybe let their mouth go or stay away from the dentist?
Well, the biggest one is phobia. The biggest one is fear of the dentist. They've been either mistreated or they believe they've been mistreated by a dentist, usually in their youth. And a lot of times they don't have the severe pain that many people have, or they self-medicate themselves to deal with the pain, but it's easier than actually facing the dentist. So that's probably the number one reason why people stay away, is fear of the dentist.
So how do you address those people? I mean, someone picks up the phone and maybe the wife calls for the husband or whatever it is. How do you get those people through that?
I acknowledge the fact that their fear is based on reality. It's not that there is nothing to fear, or that there is no that dentistry is a painless situation. But on the other hand, if it's approached properly, it can be a very comfortable situation. It doesn't have to have any pain. It doesn't have to have the fear accommodated with it. And I try to substitute my attitude and my caring for them for that fear. So in other words, I want to take away their pain. So I will not I'll empathize with them, but then I'll also show them that give me a chance to show you, and we take very little steps. One of the biggest things is with dentistry is people are afraid of getting the injection. I was lucky enough to be tutored by a master who took a special liking in me and taught me some different ways to give injections that are relatively painless, and in many ways totally painless. And the downside is it can take me 7 minutes to give a person an injection who's fearful.
That's got to be unnerving, but I guess if it doesn't hurt, they don't mind.
No, they don't mind, as long as there's no pain. And I've taught many of my colleagues this, and most of my colleagues were friends. They don't really accept it, because 7 minutes in a dental office translates to a lot of overhead that you're paying for without getting money back. In other words, dentistry is also you have to be very cost efficient in dentistry to survive, because it's a very high overhead, and time is money. And so most guys will give you an injection in 30 seconds, which is about the average time.
And what are some of the other barriers that you see from people maybe who are, who stay away from the dentist for a while, other than fear? What would you say is the second biggest one?
Cost. Cost is the second biggest one. And
so when people come into your office and maybe they've been away because of cost, what do they typically find once you talk to them about their needs? Do they find that, after all, there is kind of a way to fit it in their budget? It's not as bad as they typically thought it would be? Yeah,
well, we have many. We offer plans now that they can sign up for with it's called Care Credit is one of them, and they're basically loans that they can take out, healthcare loans that have a much lower interest than the credit cards, and there's a 3-minute sign up that they can find out what they're qualified for.
So there's all kinds of ways to just fit it in their budget for the most part.
Yeah, we find that cost really isn't a problem. It's a perceived problem, but in actuality, when people feel as if they're getting a good investment that they don't mind paying. They don't mind paying the money as long as they feel as if they're getting something that's worth it.
Yeah. Well, I would imagine you've been practicing in the same location in your neighborhood for 25 years, and you do no advertising. All the patients come to you from just word of mouth.
Right. Just
like a fine restaurant that does no advertising. I would assume that the rubber is meeting the road, that people are getting that value for what you're providing.
The rubber has definitely met the road, and one of the other things that I really pride myself on is my referral base. I think that it's my job as a general dentist to find out who the best specialists are in the area so that I can get my people who I care about to the best. And we're fortunate to have many great specialists in our area to help with some of the more complex problems.
We're going to take a quick break, and when we come back, we're going to talk about the biggest mistakes you think patients make in dentistry. I'm Dr. David Scharf. You're listening to Healthy Living Radio on WGBB.
This is Healthy Living Radio with Dr. David Scharf.
You're listening to Healthy Living Radio. I'm Dr. David Scharf. We're talking tonight with the South Shore's premier dentist, Dr. Dave Beyers, or Dr. Dave, as he likes his patients to call him. And one thing that that your reputation precedes you, and your reputation is of being a mensch, of being someone who really deeply cares about his patients. And I'll let our listeners know that I've known you for a while, and I wanted to have you on the radio. But that's really, your essence. I mean, you care more than most dentists care. And I know we were talking before the show about, you've been a dentist now 25 years. Your dad was a dentist. Your grandfathers were dentists. I mean, you've seen dentistry longer than most people. And being an expert like you are, you can sort of step back and observe. And what would you say are the biggest mistakes you see patients make, relative to their dentistry? Like if you could stand on their shoulder and whisper in their ear and say, "Dummy, don't do that. That's a mistake." What do you think are the biggest mistakes they make?
I think the biggest mistake that the patients make is choosing a dentist based on the coverage that they get from the insurance companies, instead of choosing a dentist based on the reputation, the referral, the way it always used to be. The coffee clutch when I was growing up was a tremendous source of information. The women generally didn't work, and they would get together and in the afternoon bring all their kids to somebody's house, and they would sit around and talk. And one of the things they would talk about, well, where were the bargains? What was going on? Who was good? Who was the big doctor? Who was this? And it was a very efficient way of disseminating information through the local area. And we've lost that to a large degree. I mean, it's been somewhat replaced by the internet and things like that, but there's so much misinformation on the internet. You don't even know who you're talking to. It's not a coffee clutch anymore.
So walk me through this thought a little more. What does a patient maybe give up? And not all the time, of course, but, to many patients, well, a crown is a crown is a crown. It's funny. People, are very careful about, especially women, maybe who cuts their hair. They'll only go to Frederico. I'll only go to this guy. And they're very particular about the mechanic they'll let touch their car. And yet they'll pick a dentist out of a book. Just, all right, I'll pick this guy because he's discounting. So what are maybe some of the things, and I think that comes from just, our sort of Costco mentality. I like to buy my paper towels in Costco because it's cheaper than buying them in the supermarket, but I'm buying the same paper towel. But dentistry is not a commodity. It's really a service. And so help our listeners understand, well, maybe what might be the difference between a crown done in your office and a crown done, by someone on the plan. What might be some of those differences?
Well, I think a simple way to look at it would be if you were going to be jumping out of an airplane and learning how to parachute. And you could go and take traditional lessons with someone it's going to cost you $1,000 to have this done. And in that $1,000, you're going to have 2 hours of education, and they're going to bring you up in the plane. And they're going to show you everything about skydiving, and then you're going to go skydive. And then you also have the insurance-based skydiving, which will only pay the same, and you're going to go to the same company. But so the same people that are going to give you the traditional method for $1,000 now have signed up with the insurance company, who is going to send you lots of people, but they're only going to pay you $850 for the same service. So the people think, well, hey, it's jumping out of a plane. There's no difference. What can be the difference? Well, one of the big differences would be how you pack the parachute. Mm-hmm. In the traditional way, it takes 15 minutes to pack the parachute to make sure that everything gets packed correctly and everything like that. With the insurance base, they have to do it. They have to become either more efficient, or they have to take more chances in not double checking. So because they only have 7 minutes to pack the parachute,
Mm-hmm.
It's the same with dentistry. If you use a certain type of material, which may cost you much less, you're not going to get the exact same duplication of the tooth that you're looking for in order to make a crown fit properly. If you don't use the right material, you will get a crown that may fit properly, but it maybe have some product in it from China. They have a big problem right now with lead. There you can get a crown that's made from a lab. All labs are not created equally. You can get one lab that will cost you literally $35 for a crown, and you can pay as much as $300, $400 for a crown from an extremely reputable lab. So,
see, but I think the average patient doesn't know enough to even ask those questions. I think the average person just assumes it's all the same, so I might as well just go where it's on my plan because it'll cost me less. But from what I hear you're saying is, although it costs less, it's really not the better value. It's the worst value if it's not going to last or it's inferior materials.
And I think a lot of patients actually do know that, because that's how I've survived over the years. I'm one of the dentists, and there's a lot of guys like me who we fix mistakes. That's how we make our living. We don't make a living by somebody looking in a book. I've never belonged to any insurance plan. We accept all insurances at our office, and we work with the plans, but we don't accept them as full payment, because I would be cutting my fee by 35 to 55, 60%.
Right, and I think most people don't realize, I mean, the typical overhead in the dental office is 50, 60, 70%. So if someone cuts his fee by 30%, he's got to crank it out, 3-4 times as fast.
Well, yeah, or you have to use substandard materials, or you have to do something. There is no easy way, and Long Island is made up of people who are very bright. We're not a backwoods area here, so people are aware of it, and they generally will get beat up for so long, and then they will say, I have to spend the money to make the proper investment, and that investment will last. The problem that we have is that most people do think if you're called a doctor, you're a doctor. Everyone who's a doctor has got to be the same, and it's just not true. There's an old joke that there's a special name for the guy that graduates at the bottom of your class, and it's doctor.
I love that joke.
And it's really true. I mean, the innate ability of each dentist varies so widely as to not even be. If the people really knew, it would be scary.
It is funny how in all the other things that's a service, again, your hair cutter, maybe the guy that's cutting your lawn, or who's going to babysit your kid. I mean, would you ever think of picking a stranger out of a book of babysitters? You get references, and people just don't do that. Let's change gears a little bit. I mean, you've done a lot of dentistry, and I'm sure you've seen people come into your office who really had debilitated mouths, smiles with missing teeth. They were really embarrassed about their mouths, and you talk to them, you become their confidant, you rehabilitate their mouth. I know you do a lot of those very sophisticated cases. What kind of changes do you see in people's personalities when you take them through that process?
Life-changing, and that's one of the great things about dentistry, modern dentistry, is we can really change people's lives, and we do on a regular basis, and the access to dentistry is one of the limiting factors. And again, it comes back to the cost. It comes back to the insurance company being Big Brother, riding over our shoulders, convincing people that they really should only spend the amount of money that they're getting as a benefit through their dental insurance. It's crazy.
Yeah, those benefits don't even increase with inflation. They stay the same every year.
No, actually, dental insurance, when it started in, I think, 1970, 72 was when it first came about. And the maximum yearly allotment at that time was about $1,500. Today, in today's world, 2012, the maximum yearly allowance, the average, is $1,500. Now that's
amazing, right?
That's 40 years. 40 years, and it has not moved. And people expect to get some kind of value for that. I mean, it's not even covering the cost of the overhead of the office, and yet they do.
It's a shame that people have sort of been hoodwinked, that way.
They've been definitely hoodwinked, because who makes the money? The insurance company does. That 35% discount or 40% discount doesn't go to the patient, doesn't go to the doctor. It goes to the insurance company, who's not doing anything except signing up patients with large employers so that they're making some kind of a deal with the union bosses.
And what's interesting, too, is people will spend money on all kinds of things that are important to them, vacations, fancy cell phone, all this kind of stuff. And yet they'll think, well, I can't do that $1,000 crown. I don't have insurance. And yet when you think about the quality of life that a tooth gives you, well, you have to lose a couple teeth on each side. You can't chew, you can't smile. You may lose your job, you smile, you can't get a new job because you have that space and you're competing against 40 other people that don't have the space.
And today there are so many different options of that are simple and very cost effective. And the cosmetic dentistry is traditionally very expensive, and a lot of people shy away from it. And for good reason. It's not always as good as it looks, and there are many times that it's over treatment. And but there are many. I came up with something which I call cosmetic dental sculpturing, and it's very simple. Many people all we do is we just use the high-speed handpiece to sculpt the teeth, the front 6 teeth, into a more pleasing position, and it helps. It doesn't hurt the teeth at all. You have at least
you're reshaping what they have already.
We're using the handpiece as a paintbrush, and I can't tell you the amount of just if a woman comes in with teeth that have been squared off over the years, just by putting little rounded edges in them, it gives her more of that feeling of being a woman, a softer feel. And it's amazing. And
I'll bet your patients, if I were to interview your patients, the one thing they really like about you is that you don't try to overdo, you don't try to oversell. It sounds to me, and I know this just because I know you, is that you really do for them what you would want done for yourself and nothing more, and that you've become their confidant over the years.
Absolutely. I don't ever look at a patient as a source of income. I depend on them for my living, for my income, but I never view it as that. I view it only as myself or one of my favorite children is sitting in the chair every time, and how would I proceed with them? Would I go further? Would I go less? There's something wrong with undertreating also. Overtreatment is probably is a crime, I think, and it should be a crime. It's a moral, ethical crime. Because these people trust you, and if you misuse that trust, you deserve to be punished. But undertreatment is also a crime. Many times people they're afraid to give a treatment to those who really need it because they know it's going to cost a lot of money. They're afraid they might lose the patient. Well, I'm not that afraid of losing patients. I would rather have the patient at least know, and many times it's just the opposite. I'll send a person to a specialist for specific reasons, and that patient becomes a much better patient because they value if you use the right specialist, they value the service the specialist is providing for them. And then they say, wow, Dr. Dave, you sent me to the right guy, and now I want to do that bridge that you told me about because he alerted me that there's a bone problem down there and that the bridge would help stabilize it, blah, blah, blah.
One thing I always find interesting, and for the listeners who don't know, I'm a specialist, so sometimes when patients come to my office, they're almost upset that the dentist sent them to a specialist. And I say to them, no, you have to refocus. Don't you realize that if he weren't an ethical, moral dentist, he would have potchkied around in his office, did whatever he could have done, taken your money and not solved your problem. He's sending you out of his office. He's sending away that potential revenue to his practice because he wants to have the right for you. It's sort of funny how people look at it twisted around sometimes.
It is.
It's a funny thing. We only have a couple minutes left. What's your favorite thing to do in dentistry out of all the activities you do?
Favorite thing for me is to bond and meet with the different people that we're living with on this planet. And I can't get enough of people. My favorite people are the seniors and the veterans. The people, especially the people that are still alive that lived through World War II. I find that group fascinating, and I've always had a tremendous respect for people that are seniors. I'm basically almost a senior myself, and but that's my favorite group, and they're wonderful. They appreciate the service. They've been through a lot in their lives. They really define the difference between what they're getting in my office and what they've experienced in many other offices, and they value that. They're a tremendous source of referral for me, which is great. They send in more people like themselves who are just looking to be treated fairly. And
well, you know what I think? I think that those people grew up in an era where a personal relationship with your healthcare provider and having a relationship with that person was always part of the equation. And now it's so far from the equation that to find someone that really practices like you do, and I tell you one thing I've gotten from our interview today that I'm sure our listeners have too, is you really care about your patients to a degree that many dentists or health doctors nowadays don't. So I have to compliment you on that. We just have a few seconds left. Maybe if you could tell our listeners if they want to get in touch with you, where your office is, your phone number, your address, that sort of thing.
Sure. I'm in West Islip, in between Montauk Highway and Union Boulevard, on the corner of Keith and Edmore Lane. It's in my home. I still live there.
So there's no trouble finding the doctor on Sunday if you have a toothache.
Yeah, actually, one of the things that I do that I think shows my commitment is when I have a message on my machine, you call up. The first thing I do is I say, you can call my home number, and I actually give my home number. And the patients don't abuse it. I've never had a problem with abuse of that. When they need it, they call, and I'm available for them. And again, if I'm not available for them, I have an excellent referral that they can go to and be helped in the meantime.
Tonight was a great show. I want to thank you for being on the show. Will you come back again and talk to us more? Because I could talk to you for another 3 hours. I think we barely dented the surface. It was
Thanks,
great.
Dave. It's been a pleasure.
Thanks for being on. You've been listening to Healthy Living Radio. I'm Dr. David Scharf. We'll be back next Thursday night. Thanks for joining us.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.